This video is about the Interim Federal Health Program, also called IFHP. Privately sponsored refugees have special healthcare coverage through the Interim Federal Health Program for their first year in Canada. This is separate from and additional to OHIP, the Ontario Health Insurance Program, which they are also eligible for. IFH is federally funded and it's administered by an insurance company called Medavie Blue Cross. Each refugee newcomer will receive a certificate of eligibility when they arrive in Canada and go through immigration. So they should have this document when they come out of the airport. They will need to show this document in order to access IFHP coverage. The coverage lasts for 1 year from the arrival date, so the same as the sponsorship period. But the as of date on the document itself can be confusing because it's not the same as the arrival date. This is because the IFHP certificate was issued earlier in the process to cover the cost of the immigration medical exam, and then the same certificate is printed again and given to the newcomers at the airport. IFHP covers a lot of different things, and the coverage is divided into 3 categories: basic coverage, supplemental coverage, and prescription drug coverage. Basic coverage covers hospital visits, services from doctors and nurses, emergency room visits, walk-in clinics, lab tests, and it is meant to cover the same things as OHIP until the newcomer gets OHIP. So that's the interim piece of the Interim Federal Health Program. The basic coverage is meant to be temporary. It is going to be replaced by OHIP once someone gets OHIP, and at that point, they will no longer be able to access the basic coverage portion of the Interim Federal Health Program. Supplemental coverage and prescription drug coverage last for the full year, regardless of whether you have OHIP or not. Supplemental coverage covers 1 pair of glasses and 1 eye exam, covers dental care, urgent dental care. Note that IFH does not cover routine dental care like cleanings or fillings. Services are also covered by the supplemental coverage portion if they come from allied healthcare practitioners, so psychologists, psychotherapists, there's some counseling, speech therapy, occupational therapy that's covered here. And it also covers assistive devices and medical supplies and equipment. So things like mobility aids or diabetic supplies. One thing to note is that a doctor referral is required for many of the things that are covered in the supplemental coverage category. And the third category is prescription drug coverage. This program will cover prescriptions for generic versions of drugs, and the coverage is similar to the coverage that a provincial public health care plan, drug plan would have. So if somebody went on to Ontario Works or social assistance after the sponsorship period, they would have the same kind of prescription drug coverage that this program has. Remember that IFH will not ever reimburse a beneficiary. So don't ever expect to pay for something and then have this program pay back. IFH covers certain dollar amounts for each benefit. So, for example, if you're looking to get an eye exam, IFH covers $95 for an eye exam. The service provider might charge $150 for an eye exam. So even if they accept IFH, they will charge you the difference. So it's best to confirm first if there will be any additional charges, because you may then choose to find a service provider who only bills what IFH covers. For many things, such as physiotherapy, counseling, speech language therapy, other mental health supports, a doctor's referral is required. So the newcomer cannot access the service directly without first having seen a doctor and received a referral. And finally, to access the coverage, the service provider has to be registered with Medavi Blue Cross. So you need to check first to make sure that the place you're going to where you plan to use IFH, that service provider is registered with Medavi Blue Cross to accept IFH. You can do this by checking the list of service providers online. If you search in a search engine IFHP service providers, you will be taken to this wonderful website that allows you to put in your address, put in the type of service provider you're looking for, press search within a certain distance, and it will generate a map and a list of all of the service providers near you that accept IFH. So in this example, I've put in Aura's address, I've searched optician, and you can see on the map there are many, many opticians in our area that accept IFH. You can also check the benefits grid online. If you search IFHP benefits grid, you'll be taken to this Government of Canada website that lets you click on the dental benefits grid or the supplemental coverage benefits grid. That will take you to a very big, detailed document that tells you exactly what is covered, the dollar amount, the frequency, and whether or not referral from a physician or another healthcare provider is required in order to access the service. This document also lets service providers know whether they need to get pre-approval from Medavi Blue Cross or not. There are certain things you really want to take advantage of. For example, the coverage for one pair of eyeglasses and one eye exam per person. And if somebody has extensive medical needs, there's a whole lot of additional coverage they might benefit from in this program, but they will need the help of their sponsors to access it. Remember to explain IFH to the newcomers. We can't expect that they would know anything about this. And remember that it only lasts for 1 year. So if someone is accessing a lot of care through this program, they need to know where they're going to be able to access that care and coverage after the sponsorship period is over. Thank you for watching this video about the Interim Federal Health Program.